exercise questionnaire. It's pretty straightforward, Chris. If you're uncomfortable answering any of these questions, just let me know. I mean, um, it's not super important, but it's maybe something you should think about if you're not sure about some of these questions. Then maybe you should see a doctor before
Yeah.
consulting any more training. But really, straightforward. At this point in time, do you have any medical conditions or injuries or anything that we should be aware of to take into account?
Yeah. Bad knee, bad shoulder.
Okay, how do you, which knee?
Right knee.
Right knee? How'd you do that?
It's from a bad posture while snowboarding.
Okay,
I have been taking physio.
so right knee from snowboarding. How long ago was that from?
Last winter, so what's that? November.
Okay, so that was almost
10.
12 months ago,
Yeah,
10, 12
10
months ago.
months.
Okay, and you've been doing a little bit of work on that?
Yep.
Excellent, cool. And the shoulder you mentioned?
I landed on my shoulder while snowboarding.
Ah, so snowboarding's doing well for you.
Oh yeah.
And which shoulder was that one?
Right shoulder.
The right shoulder, so the right side is taking a good beating.
Oh yeah.
Okay, and have you done anything for your shoulder in the last 10, 12 months?
Just repeating the strength exercises I got 4 years ago
Okay.
and stretching.
Okay, so you do have a little bit of injury, but nothing super modern. It's all a little bit older, and you've done a little bit of work on it.
Yep.
Cool, good to know. Well, we'll see when we do the assessment, especially with your posture, if that's been any issues or deviations in terms of how symmetrical your body is. But we'll get to that. On a deeper level, some things that can impact your ability to exercise. Do you or your family have any history of high blood pressure, heart disease,
Yes.
diabetes?
Yes.
Yeah.
Yep.
Which one?
All of them.
All of them. You yourself or
No.
family history? Okay. So
All but the last one.
okay. So your family has a few things to take into account. Have you been checked yourself by a doctor to see if this is something that you should be aware of?
I
Or
currently don't suffer from these things.
okay, but you haven't had your blood pressure or anything tested recently.
Lost blood pressure this year at some point.
Okay, you've never had dizzy spells or fainting spells
No.
when exercising. Okay, cool. So we'll assume that's okay for now, as well as we can. But obviously, if you do start to develop some of these things, because you do have a history, maybe that's something worth looking into. And then on more of a personal note, just as we move forward with some training, with your lifestyle, you've kind of read over this a little bit, but
Mhm.
do you smoke,
Nope.
drink,
Yes.
a lot, a little bit, recreationally?
Recreationally.
Recreationally? Okay.
Time to time.
I think everyone has one from time to time. Any recreational drugs or
No.
prescribed medication?
No. Currently.
Okay, cool. And do you partake in a lot of sugar?
Obviously. Living Western man.
Yeah, unfortunately there is sugar in pretty much everything we eat now. But as long as you don't overindulge or kind of you don't eat like a couple of kilos of candy a day or anything or
No.
a lot of soft drink or anything like that. Okay, cool. Good to know. I mean, some people do take these things, and I mean you can balance them out depending on what your eventual outcome or goals are. But obviously, the sugar isn't necessarily a great thing to be partaking in. And speaking of goals, what would you like to get out of kind of a training
Ah,
regime?
better physical condition to prevent injuries, mainly.
Yep. Uh, that's pretty much what we're all looking for, I assume. Especially since you've had a couple of injuries in the past from snowboarding, it'd be good to try and lower some of those. Cool. So as I said before, we get into anything serious like lifting weights or
Yeah.
making any specific movements, we're going to do a few posture assessments just to make sure that everything's in working order, especially the spine and the hips.
Mhm.
If everything's stacked in an efficient way, like the body is designed, then you're less likely to have more injuries in the future, um, or have any further issues.
Yep.
So what we're going to do is we're going to use a plumb line, which I've just got set up behind you, and we'll go through this real quick, and I'll talk you through it so you know what I'm doing. But basically, I want you to stand in front of me on the other side of the plumb line. Yep, and you want that pretty much in level with your nose. If you can see in level with your nose, and I'll adjust myself. Cool. So what we want to see from a front angle, so just stand however you're comfortable. Basically, if you're nice and symmetrical, which is how the human body is
Yeah.
designed and is supposed to grow up, we should have pretty even on both sides. If unfortunately, due to sports and injuries and things like that, most people have small deviations. Small things aren't necessarily an issue, but the bigger they become, if we don't address them, then we start to have more problems. So if we follow this down, we'll start at the base. I mean, like a house or any kind of building, the foundation's where we start. If the feet are correct, it's going to affect how the legs, the knees, then into the hips, and so on and so forth. So I want you to try and turn your feet so that they're relatively straight. You want to make like an 11 with your feet if you've ever thought about that as you look down. And just get yourself in a comfortable position. Sweet. So if we look at your feet, a couple of things we're looking for to make sure that you don't have too much arch in the foot here. Basically, you should have nice contact all around the feet there. And then coming up, if you mind hiking your shorts just up a little bit, we just want to have a look at your kneecap there. Cool. So we have nice contact with the feet, pretty even if we look at the plumb line from straight on. Kneecaps pointed nice and straight forward, directly over the big toe, which is where we want them. They're not twisted in or out, which could cause issues from your hip flexors. Plumb line dropping straight down the middle. If you mind, just hike your shirt up a little bit. Yeah, there we go. So if we look at the line of your shorts there, you can pretty much tell if someone has a tilt in their hips from this position. And what that could mean is that one side or the other of your body could be a little bit stronger, a little bit tighter, weaker or stronger muscles. Can actually be quite common in snowboarders because tend to ride in one direction a lot, so develop that imbalance. From this perspective, looks pretty good at this point, and we don't want to be super pedantic. So yeah, that looks really good from here. As we come up, you can relax your shirt now. We're going to look at your shoulders. So we want to make sure that both shoulders are nice and even, and we don't have too much lift or height or drop on either side. My camera works terrible, don't worry about it. But they'll get the idea. Cool. Again, looks nice and even, a little rounded, but that's something we'll check when we have a look at the side angle to see what's going on with your back, and that could be something from sitting at a computer for half the year, which is pretty common for most people. And last but not least, just the facial symmetry, making sure, I mean, obviously you're born with the face you're born with, but if one side of your neck is tighter than the other, or your trapezius is tighter than the other, it can pull the head out of alignment. So just making sure that the ears are even, the head's up. So, I mean, realistically, you look pretty straight on there, Chris, from this front perspective. So what I'm going to get you to do is take kind of a relative note of where your feet are using the planks on the floor. And I want you to spin around for me so we can have a look at you from the back angle. Yep, keep going. We'll do the side one last. Let's keep going around. Yep, there we go. Excellent. So now if we look at the plumb line from the back angle, basically want that to drop again. Should drop right between your shoulder blades, in the middle here, down through the sacrum, the tailbone, and right in between your 2 feet. So what I can see from here, if you look down at your feet, they look pretty even to you. You don't have one too much forward than the other?
Yeah, pretty.
Okay. They look even to me from here as well. And what I can see from this back angle is you have a slight rotation of your hips to the right hand side. Yeah, so you can see that, right, when you pulled that back. Yeah, the plumb line drops, and it's really convenient, the stitching in the back of your shorts here. You can actually see it doesn't sit even with that plumb line, and that shows a slight rotation to your left. So that right hip is twisting forward. Do you tend to snowboard in a regular fashion? Yeah, so what that is, it's your body, it's repetitive motions, just training the body into a specific stance. But what that can do over time is it's causing the left leg to take more of the strength of your body, and it's not sitting the spine directly over the pelvis, directly over your base of support, which is your feet. So it could potentially lead into some issues later on. So that's something that's definitely worth looking into. But that's good. So what I'll get you to do is turn to, let's go your left. Cool. Alright, we'll try and find a good position there. Yeah, actually that's almost perfect. Sweet. So from the side here, this plumb line, what we want to see is it dropping from basically through your ear, through this kind of bony protrusion here at the point of the shoulder, down through the front of the kneecap and into just in front of the shin there. Cool. So is that a comfortable stance for you? You're not kind of overworking it, trying to do anything specific, just relaxed? Excellent. So from that side view, what we want to look at mainly is this angle of the spine. So the spine has three main curves. You've got the curve from the head through the neck to the back, and then a rounding of the back here, and then another inwards curve at the lower back here. You want to make sure there's not too much or too little curve, and that's something that I'm specifically looking at on your behalf. But everything is sitting in a pretty comfortable position at this point. It looks like you might have a little bit of a rounding in the spine, as we said before. We could kind of notice it a little bit with your shoulders. Your shoulders sit a little bit lower. If you kind of pull that scapula or those shoulders just up and back a little bit, you can feel that difference straight away. There you go. But that's something that is definitely super common in people that sit at a desk almost all the time. At least half the time you're out, and the snowboarding is working on a whole different thing. But what that means, it basically means we need to train this the scapula, or the muscles related to that, the rotator cuff muscles, the latissimus dorsi, trapezius, basically all those muscles in the back to help pull your shoulder blades back into a correct position. Because what that does in the long term is, even though it's very slight now, that little bit of extra weight isn't sitting stacked directly over your pelvis, and so it's putting a little bit more pressure on your lower back. And then eventually over time, as your curve in your upper back gets worse, that pressure on the lower back is going to get worse, and it can eventually lead to a hunch or back injuries or so on and so forth. So yeah, just little things, nothing super serious right now. Just it's actually really good to be aware of these, because then we can get them started sooner rather than later. Cool. So I'll fill out the paperwork on that later. There's one other test I'd like to do if you're keen to keep going. Oh, sweet. So I'm going to get you to step over here. We've got a little bit of a setup with the string, the chairs, and that ski pole there.
Yeah.
So I'm going to get you to step on the other side of the chairs for me. Cool. I want you to position yourself so your feet are not quite shoulder width apart, because what we're doing here is more testing what it would be like when you walk, and no one walks with their feet shoulder width apart. Your feet are a fair bit closer. And then I want you to shuffle a little bit forward so your toes are just underneath that string. Cool. Excellent. Last but not least, you're going to take the ski pole and you're going to put it on your back. Have you ever done squats in the gym?
Yeah.
Pretty much exactly like that. Nice. Just in a comfortable position, gets you balance. So now what we're going to do, and hopefully we won't see too much of a difference, but we might, because you have mentioned that you've had issues with your right knee before, is we're going to do what's called the hurdle test. And this is a movement test, so it's seeing if you can maintain stability whilst moving. It's emulating basically activities of daily living, so walking, going upstairs, how your body shifts, and does it shift in an efficient way so as to move correctly and not endanger you for injury, basically. So what I want you to do, just nice and slow, doesn't be super slow, but again, not too fast. Just want you to shift your weight into your left leg first, and then you're going to lift your right leg up over the string and just touch your heel to the ground, and then you can bring it back. You only have to lift it high enough to get over the string. You can look down to check it out for your first couple. It doesn't have to be really high, but just a couple. And then you're going to shift your weight onto your right leg. Okay, you're going to lift that left leg up, bring it over, touch the heel down, and then bring it back. Excellent. And I just want you to do a couple on each side, at least 5 or 6. And what we're looking for is, yeah, nice. So make sure that on the foot that you're standing on, keep it nice and stable. Feel that foot flat on there. You don't want it to roll too far in or too far out, because that's going to get that knee out. No, you take your time. I mean, if we notice these things now, it's something we can work on for later. Excellent. there for a second. Now you've had a bit of practice. We're going to do a couple on just the left leg for now. So shift your weight onto your left leg. We're going to do 3 or 4 in a row. So I want you to go for it now. There you go. You've got nice stability on that left leg. The foot looks good. The knee is stacked directly over the toe. You can relax that knee a little bit. It looks like you've got a little locked out. Very nice. Cool. Hips look pretty even. Stick on your shoulders is parallel to the ground. All looks really good. Looks like you've got great stability in that left leg, which is something that we expected, right? That's the leg that you snowboard on more. It hasn't had a previous injury. Cool. Now I want you to shift your weight onto that right leg. Take your time, there is no rush. And then when you're ready, you can start to go over with the left leg. We'll do 4 or 5 of these again. Cool. So you can see the inside, definitely a little bit more shaking on that right foot. Adding in, it's kind of rolling out a little bit, supinating. The knee's actually fairly well stacked, has a little bit of a shake to it as well. But one of the biggest things I notice is that you compensate by your right hip dropping to the side and your shoulders drop down a little bit. That's what the stick on your back is for. But I mean, as we said, it's not a super big thing, and it's something that we fully expected because you have had injury on that side before, and that's something